Hello and good morning. What I want to explain to you today is how to treat COVID-19 or virus infections or infections and chronic diseases and so on with orthomolecular treatments, as I show you on the slides I open right now. You see the holistic view on COVID-19 treatments with orthomolecular vitamins, trace elements, etc. About me, I have a doctor's practice for naturopathy since 1989 at Lübeck. My main tool is in diagnosis, the applied kinesiology, AK, from George Goodhart, Dr. George Goodhart, US, and the orthomolecular medicine, OM, in connections, let's say, with Linus Pauling, who founded it about 70 years ago, also in the US. I'm the founder of HOT, hypoallergenic orthomolecular therapy, with pure Hypo-A products against chronic diseases. Hypo-A means a firm who produces under my development really pure capsules and remedies to heal, not to make disease management. Food research for holistic treatments from allergies, arthritis, Crohn's disease, and colitis to pain over rheumatism to skin. For example, pain, with our remedies, we are able to switch off pain very often immediately, in seconds, in parts of seconds. I give a little bit of the capsule of, for example, vitamin B complex plus in the mouth. I let chew a little bit, and then the movement of the leg, of the arms, of the legs, and so on, of the knees is nearly free or is free. It's very impressive. What I want to share with you, first, background about the causes of chronic modern diseases and influence of environment on lung infections such as COVID-19. Second, COVID studies on trace elements, vitamins, and so on. There are lots of information around the world how to treat very sufficient COVID-19, not only by injections, not only by my English is not so good, but you will know, you'll understand what I want to say. And it's third, the design and development of curative regeneration programs with hypoallergenic orthomolecular therapy, HOT, with results of patients and studies. Background about the causes of chronic modern diseases and influence of environment on lung infections such as COVID-19. This is very impressive for me, and it's the basic I made clear about 30 years ago in my practice. All disease begins in the leaky gut. The role of sonulin-mediated gut permeability in the pathogenesis of chronic inflammatory diseases, CID, as chronic bowel syndrome and so on. The gut microbiome and loss of mucosal barrier function may substantially affect antigen trafficking, influencing the bidirectional interaction between gut microbiome and immune system. CID suggesting a key pathogenic role of gut permeability, autoimmune, infective, metabolic, and tumoral diseases. For example, Hashimoto, you might know as autoimmune autoimmune disease, and Hashimoto is perfectly treated in 6 to 12 months with our step-by-step treatments. Air traffic in Central Europe, 2019. Respirable dispersible dust doubles the level of LDH, IL-6, and IL-8 in bronchial tubes. That means the lungs are infected, affected, are treated, bad treated and are disturbed by the dust which is inhaled in the lungs. Respirable dust during New Year's fireworks in Germany. Up here you see at the blue zones there are less dust, and there are nowadays less infections. You see down here, the more pollution, the more COVID cases, less industry, less COVID cases. Here is overcrowded and much industry, and therefore there is more dust and more infections with COVID. The immune system is lowered, is bad influenced by the dust, and so we can't work against infections. Respirable dust makes people ill. Small particles impair the tissues of the lungs, exacerbate pulmonary diseases, and cause heart attacks. In children, it leads to otitis media via swallowed sputum. In former times, 20 years, 30 years ago, I had a lot of children here, 3, 4, 5-year-old children who should be searched by surgery by the ears because there was water in the ears, in the middle ears. And I said, or I recommended, no sugars, no sweets, only organic food for about 4 weeks, please. And then the ears were very okay. They didn't need any further treatments. Penetration of respirable dust causes nasopharyngeal chronic inflammation that may influence by adverse effects the intestines, the function of the brain, and the cognition, not only in children, the function of the brain, also nowadays of the politicians, you know. Respirable dispersible dust exacerbates COVID-19 mortality. In Europe, about 20% of COVID-19 deaths are due to air pollution. Scientific authorities, Max Planck Institute for Chemistry and the University Hospital of Mainz in Mainz. Globally, about 15% of COVID-19 deaths are caused by dispersible dust and nitrogen oxide. Here we see 3 different colored zones. Up here, the red ones, here the green ones, and here the yellow ones. The influence of plastics, heavy metals, virus, germs, fungus, but also stress, solvents, pollution, respirable dust, thioether, softening agents, and food additives lead to nitrogen stress in the body. We lower with the by the nitrogen stress the superoxide. We come to mitochondrial disorders. We have oxidative stress in the body, and that leads together with the nitrogen stress and the mitochondrial disorder to silent inflammation over here in the yellow zone, to faulty immune system and allergization. When I was a child, there were only none or 1 or 2 children in my class with allergies. Nowadays, you have about 20, 30, 40% of the children with allergies, with neurodermitis, and so on. No doubt about the health risk from chemical BPA. Bisphenol A functions like estrogen and seems to be responsible for cardiovascular disease, sexual disorders, and diabetes mellitus. You know this up here, Pepsi and Cola and whatever in cans, and they are full of bisphenol A. And I say, good health, buy a cup of tea. I'm Frisian, and the Frisians need tea around the clock, so I have my Assam tea from India. The Assam tea doesn't have, or is not toxified by BPA. The European Foodstuff Control, EFSA, reduced the critical value of packaging dramatically from 50 to 4 micrograms per kilogram body weight and day because of health risks, 50 to 4 microgram. What I want to share with you are COVID studies on trace elements, vitamins, omega-3 fatty acids, and so on. Liver-lung interactions are in critical illness. You see, we spoke about the dust, we spoke about the surface of the lungs, and so the lung and what you give up and swallow in your intestines is gone through the liver, and then it returns via the blood flow to the lungs. So we have a circle of liver, lung, liver, lung. That's the background of this paper. Organ interactions are increasingly recognized as key determinants of the pathogenesis and potential for resolution of tissue injury during critical illness. Liver-lung interactions are presented as a heuristic paradigm of organ interactions that dynamically modulate systemic immunophysiologic responses during critical illness with COVID-19. That's very important. If the liver is not functioning very well, if the lungs are not functioning very well, so we have a bad immune system over the time, and then we are infected and severely infected. Good vitamins help in the fight against COVID-19. Vitamins A to E highlighted potentially beneficial roles in the fight against COVID-19 via antioxidant effects, autoimmune modulation, enhancing natural barriers, and local paracrine signaling. Level 1 and 2 evidence supports the use of thiamine, vitamin C and D in COVID-like respiratory diseases, ARDS, and sepsis. That's known since 60, 70 years or more. But today we don't treat those people, those patients with vitamins normally in the clinics or hospitals or in the universities. Optimal nutritional status for a well-functioning immune system is an important factor to protect against viral infections. Above you see the HTTPS PubMed numbers. You can copy that and you can go to the original paper to read the whole things, what is written, what are the circumstances for that study. So you can get further information if you look over there. In 2016, acute infections of the respiratory tract caused about 2.4 million deaths worldwide. 2.4 million deaths worldwide. Many clinical data show that vitamins A, B6, B12, C, D, E, folate, and the trace elements zinc, iron, selenium, magnesium, as well as omega-3 fatty acids are essential for a stable immune system and good health. For example, magnesium is very, very important to produce proteins, to produce immune globulins in the body. And magnesium as carbonate, which lowers the acidity in the body, is able to fight against small babies, small for-date babies, if you give it in a bigger amount during the pregnancy. That's very impressive to see. If you have a small for-date baby, you treat the mother with magnesium calcium or magnesium, but with carbonates. In only 4 weeks, you see a growth of about 30% or more in only 4 weeks. I have seen it in my practice. Supplementation of the above mentioned pure nutrients is safe, effective for the immune system, and cost-effective for the public health systems. Feeding above the recommended dietary allowance, RDA, and to the recommended upper safety level, RUS, for vitamin C and D is valid. The effect of vitamin D substitution related to risk of intensive care in cases of COVID-19. On the left side, you see the vitamin D substitution. Only 2% of these infected patients came to intensive care. The control group without substitution of vitamin D, about 50% intensive care, and from these or from those, they have about 20–30% risk for death. Vitamin D deficiency as a predictor of poor prognosis in patients with acute respiratory failure due to COVID-19. Many COVID-19 patients in intensive care with acute adult respiratory distress syndrome, ARDS, showed a vitamin D deficit. Patients with a severe vitamin D deficit had a 50% higher mortality risk. That was significant. What are we waiting for if we don't treat with vitamin D? Evidence that vitamin D could reduce risk of influenza and COVID infections and death. It is recommended that people at risk of influenza and/or COVID-19 consider taking 10,000 international units per day of vitamin D3 for a few weeks to rapidly raise vitamin D concentrations in the blood, followed by 5,000 international units per day. In Germany, we say, or the Robert Koch Institute says, you need only maybe 500 or 800, maybe 1,000 international units per day. But more is difficult, is risk for your health. Maybe you are full of calcium in your intestines, in your blood system, and so on. Atherosclerosis is the key for Robert Koch Institute. For us, health is the key and not the illness and disease management. The aim should be to raise 25 OHD concentrations above 40 to 60 nanogram per milliliter or 100 to 150 nanomole per liter. No side effects, you can be sure. The emerging role of vitamin C in the prevention and treatment of COVID-19. One small trial from China has finished early, and the findings are currently under peer review, but it's published at PubMed, you see. There was significantly decreased mortality in the more severely ill patients with severe respiratory infections, for example, COVID-19, who received vitamin C. We know since 60, 70, maybe 90 years that the intravenous treatment with vitamin C lowers the infections dramatically. If you have enough vitamin C, your immune system is reinstalled, is stabilized. Can zinc be a critical element in COVID-19 treatment? Zinc supplementation can favor COVID-19 treatment using chloroquine as recommended drug. In my practice, I never recommend chloroquine, but that's another aspect. I am naturopath. The effectiveness of zinc can be enhanced by using chloroquine as an ionophore, while zinc inside the infected cell can stop SARS-CoV-19 replication. And down here you see antiviral and anti-inflammatory effectivity of zinc is proved in about 5,000 studies. Also PubMed. You give the term zinc plus virus, and then you have about 5,000 studies. Does zinc supplementation enhance the clinical efficacy of chloroquine, hydroxychloroquine CQ, HCQ to win today's battle against COVID-19? Zinc deficiency frequently occurs in elderly patients with cardiovascular disease, chronic pulmonary disease, diabetes, or silent inflammation. You remember most people who died last year from COVID-19 were elderly people. They were in homes with elderly people. They got bad food from big kitchens, maybe in Germany, they got it from Poland or something else. The food was prepared days or weeks before and then was brought to the houses where these poor people, elderly people, old people lived. They got less vitamins, they got less fresh food, they got really not organic food. So they had no zinc, they had no vitamins, nearly no. And therefore, the death rate was very, very high. CQ and HCQ plus zinc supplementation may be more effective in reducing COVID-19 morbidity and mortality than in monotherapy. I ask you, why should I combine with chemistry if I have a very sufficient treatment with zinc? The highest dosage of zinc I gave to acute ill people was 500 milligrams zinc per day, 3 days. That was a couple of sports ladies in a world championship. They had an accident and were damaged here, right here. They couldn't breathe, they couldn't work with their arms and so on. And I treated with 500 milligram zinc in combination of vitamin B complex plus trace elements and aceroate zinc. And I recommended 5 liters water per day, each day, 5 liters water, to make a pressure in the tissues, a water pressure and a cleansing up of the tissues, connecting tissues. And after 4 days, they won the silver medal instead of laying in the hospital. What I want to share with you, design and development of the curative regeneration programs with hypoallergenic orthomolecular therapy, HOT product range with results of patients and studies. Our recommendation, orthomolecular intestinal regeneration, OIR, as basis for a good health, a strong immune system, and fast recovery of convalescence. ITIS Protect as professional protection against silent inflammation, CBD, chronic bowel disease, and infections like periodontitis, but also morbus Crohn, colitis, and pancreatitis, and so on. Allergies, burnout, CID, COVID-19, orthomolecular intestinal regeneration, OIR. This is written in German, but the rehabilitation package is the first step against leaky gut, for example, 4 weeks. Then we have the ODS in German, or OIR 1A for the small intestines, and the OIR 2 for the large intestine, for the colon. And if you treat 3 months, 1 to 3 months, then we have finished about 60, 70, 80% of the problems of the patients. Here you see a viral dermatitis herpetiformis, clinical evidence, and after 10 days rehabilitation package. This small girl, 5 to 6 years, was in the Charité Berlin, and they wanted, after 4 weeks, insufficient treatments, they wanted to treat her with biologicals, with cancer medication. And the parents said, no, we avoid cancer medication in children. It's not allowed, and we don't wish it. We take our lovely daughter home. So they contacted their pharmacist, and this pharmacist near Berlin knew me and knew our firm and the quality of our products. So they asked me what to do, and I begged about photographs, what is the sign, what's the picture of the child. to have an impression. And then I treated only with rehabilitation package 1, the first 4 weeks. And this is after 4 months HOT and orthomolecular intestinal regeneration, OIR1A and OIR2, and you see the lovely girl, healthy girl. ITIS Protect, your professional protection against periodontitis, infections, all types of infections. Therefore, ITIS Protect, allergies, diarrhea, burnout, and pain syndromes. I explained just before, we can switch off pain immediately, but pain is a very important sign in connections with your health. If there is pain, you shouldn't take a painkiller. You should take a pain solver, resolution, to switch off the pain on the point where it occurs from. For example, I have here a picture, you might see it, and you see the bodies, you see the muscles, you see the different colors of the muscles, and then I switch off and change, and here you see the programs of the different meridian connections, the liver, the lung, the heart, and so on. And then you see the remedies over here, how to treat, what to treat. In the beginning, it's fat printed. So the most important in every row are fat printed. The others, which may be important, are normal printed. So you have a directly possibility to treat with the adequate substances. Here we did a study with the AMMP8 orthomolecular study with severe chronic periodontitis. It was done with the university in Jena and Marburg. And in the beginning, people were had received some years or 2 years before at least 2 treatments with antibiotics, broad antibiotics against periodontitis, and 2 surgery treatments to cleanse up and so on. And the infectional status or the destructure status was measured by AMMP8, and you see we have a high range in contrary to the healthy zone. After only 4 weeks, ITIS 1, we see the most destructional people had the best effect. The others lowered in about 3 months to 50% healthy people. And this row is going up. We have here the healing crisis. Why? Because this group has more difficult damage in the microbiome, intestinal microbiome, than this other group in this row. And we see after only 4 months, 60% are healthy, and 100% of the values, AMMP8 values, were lowered. I combine very often with segmental therapy. You see here the liver, the pancreas, and the kidney in the front and in the backside. We say also in Germany, homocysteine tree, because it are points of acupuncture and homeopathic remedies, combined remedies, anti-inflammatory, and hepa is for the liver, pancreaticum is for the pancreas, and beberol is for the kidneys and bladder. And if I treat in this manner, and I test before with applied kinesiology, and I test the remedies, I have in my practice the hypo-A remedies, then I have a chance, or my patients have a chance to come after they came in with severe pain, to go out of the practice after only 1 treatment without or nearly without pain, about 80%. Fibromyalgia, you may know, I say fibromyalgia is a cry of the body for orthomolecular treatments. and this segmental therapy. And we treat it in about 4 weeks, 8 weeks, maybe 3-4 months, and then people are healthy and not 20 years fibromyalgia. Organ function under orthomolecular OIR, liver, pancreas, and intestine. Intestine, we have the diarrhea, severe diarrhea. I have patients with 20, 30 diarrheas each day. And the lipase is the hormone or the enzyme of the pancreas. And gamma GT is an enzyme from the infected, inflamed liver. And you see, all are disturbed. After only 4 weeks, rehabilitation package is only for 4 weeks. We see a lowered infection, decrease of the enzyme, and the lipase is normalized, and the diarrhea is diminished about 70%. I have a lot of patients who are treated only by the rehabilitation package and don't have any further diarrhea after only 4 weeks. And after 3 months, we see it's all in green. And these patients are patients who prefer at least once a month or so to go to McDonald's, something like that, and then they have diarrhea, and that's logic, that's good for the body to cleanse up with diarrhea, out, water, and then you are healthy. If you have diarrhea or if you have vomitus, you should take the 3 Symbiosis Plus from Hypo-A. You can chew it, maybe 2 minutes, 3 minutes, the capsule or 2 capsules, and then you swallow in 2-3 swallows, so to say. And after every diarrhea or after every vomito, you chew again new capsules, and so diarrhea or vomitus is gone in 2 for 8 hours. It's gone, it's finished. A better quality of life and mood pre-final with cancer using HOT. We see down here the expected lifetime at the red line, expected lifetime about 4 or 5 months, 6 months maybe. And you see here the quality of life, no HOT, quality of life with HOT, activity, mood, and weight. And all these things are going up in between 2-3 months. And we have a longer lifetime, as we see here. And I explained to cancer patients in the first consultation, I can't longer your life. I can't longer your life, sorry. But I can better your life. You have a better quality of life. You have a better mood. Your weight will grow up a little bit. Your activity will be better, and so on. And if you come to the end of your own organic, holistic system of your body in connections with the cancer, you will switch off in 2, maybe 4 weeks. But until that point, as we see here, you have a high quality of life, and then it's switched off. And all patients say 2 weeks, 4 weeks, no problem. But this is awful. I want to spring, for example, from a skyscraper, something like that. But that's not a life I want to have. HOT, pure natural supplement with natural vitamin C, 110 milligram, and zinc, 10 milligram. Not more is allowed in Germany because zinc is so poisoned. It is so poisoned. It is harmful for life. No, it's not harmful for life. It's harmful for pharmacists and pharmaceutical industry and the doctors who want to make surgery on you, destroy your health. Therefore, it's very poisoned. It's very terrific. Flu with fever, 3 to 4 times, 2 or 3 or 4 capsules per day with a bit of food. If you take zinc without food, then you may have disturbance in your stomach because zinc makes vomitus. Zinc makes also, if it's given in a empty stomach, it makes cramps and so on. So a little bit, maybe a banana or a part of a cake or a bread or slice of bread, something like that, and then you can take it. HOT healing of several viral infections such as flu or COVID. Here we have the children and here we have the adults. And that is no treatment, none, nothing is done. About 40 to 60 days illness. Conventional treatment, you know that virus infections very often, at least in Europe and US, maybe too, maybe worldwide, are treated with antibiotics. Against virus, you can't use antibiotics. If you treat with antibiotics, you destroy the microbiome and you destroy the immune system of the patients. Therefore, you have bad results and you have all along more ill, severe ill people. But that's the key in some practices or some countries. If we treat with HOT, we say it's 2 days or 3 days, and then the infection is finished. Holistic therapies on COVID-19, acerola zinc nose spray, homemade viral protection. And nowadays, it's very, very important. Here you see a small bottle for nose spray, and here you see the acerola zinc. Add a quarter capsule of acerola zinc to a clean 10 milliliter spray bottle and fill with lukewarm boiled water. Shake the bottle vigorously. After about 10 minutes, shake it again. Then spray a small amount of the liquid in only one nostril for testing. If it is a burning sensation because you gave more than a quarter of a capsule, or it's for you too much, tip a little bit water out, about 10%, and add water. Spray both nostrils several times a day and inhale deeply with the effective and protective vitamin C and zinc liquid for therapy and prevention. You should keep in mind that you need really pure remedy. You can't do that with, let's say, a solved tablet or something like that, or a dragée. You can do it only with a pure remedy like Hypo-A from hypoallergenic. No additives, no fillings, nothing. Or if fillings are necessary, then that are fillings which are biological adequate. You can be treated with that. Conclusion and recommendation, health protection and treatment, not only of COVID-19, sorry. Healthy, fresh, organic food and no additives. That's the most important information from today. And then optimization of the immune system with vitamins A, C, D, E, K, zinc, and magnesium. Magnesium I explained before. Detoxification plus orthomolecular HOT and OIR for the small and large intestines. Homemade acerola zinc nasal spray, as explained just before. Drinking at minimum 2 or 3 liters clean, fresh water daily. My patients, I explain, look at my hand. Tea is no water, coffee is no water, wine is no water, beer is no water, but also whiskey or cognac or something like that, ouzo, is also no water. Only water is water. Look at my little finger, water is water. So if you are ill, you should drink at least 2 liters, 3 liters water every day. And if you have during the day severe pain suddenly, then you drink 2 liters water in only 1 hour. And then you go to toilet and you bring to the toilet your pain. And that's true in about 80% of the cases or more. Avoidance of plastic boxes and Teflon. Plastics like Teflon, Teflon, we had plastic boxes, Tupperware, you know. Physical activity in the fresh air. That's also very important to be healthy for a long time, also if you are elderly. This is a film, Wheelchair and Walker Goodbye. That's me, and this is an American patient. And you can see this film on YouTube, Wheelchair and Walker Goodbye. It's behind, I think, Wheelchair or Gehwagen or VBN minus Verlag. Or you can find it, the link here at Naturkunde Volkmar. So I thank you very much, and I hope it was interesting for you, and maybe we see each other another time. Have a good time, stay healthy, try to do the very best. Maybe you look twice or 3 times, 4 times this film, or maybe other films from me, also this one here with the wheelchair, to understand the whole connection of the system we developed here in my practice with Hypo-A from Lübeck, Hypo-A GmbH. Thank you very much. Goodbye.